Hi, my dog lovers. Hi, good afternoon, good evening, good morning, wherever you are. My name is Dr. Peter Dobias, and for those who do not know me, I'm a holistic vet and I teach people how to keep their animals and dogs especially healthy without the use of drugs and chemicals and processed food. And today I have something really important for you to know and learn. I'm actually really happy and proud that I've managed this major topic, and that's dental care for dogs. I kept writing and writing, and I realized that there was so much to share. It took me several days to complete. And then I created this slideshow and realized that I can't actually show it to you online because it's all reversed. So you can see that it says no more smelly breath, one-on-one of natural dental care for dogs. And today we have a lot to talk about. So I'm just going to start. And I have also one of my team members, Angela, here. For those who know her, she's one of the founding members of our team, and she's going to be answering questions, actually not answering, but collecting questions regarding to dental care. And then we are hopefully going to have enough time to answer at least some of them. And if not, then we will try to do our best to answer afterwards with my team. Angela, are you there? She may be there.
I'm here. Yes, I am here. And hello, everyone.
Thank you so much for being here. Now, I have something ringing here, but I don't really know what it is, but I'm hearing some ringing. Maybe it's my ears. So I know that most of you are worried about your dog's teeth. And I also know from the experience that most people actually are trying to avoid to deal with teeth by going to the vets, or many people. Because it often happens that, dogs are put under anesthesia, and most people are worried about anesthesia. So it kind of becomes a little bit of a problem, right? And the purpose of this broadcast is to actually dissolve some of the myths about when anesthesia is needed, when it's not needed, and what are the alternatives to regular conventional dental care. I have something really ringing here, and I'll just try to see. Is it you, Angela, or is it me?
I think it's the timer.
Oh, it's timer on my iPad. There you go. Thank you. I thought it was my ears. So anyway, I'm going to start from very early age of your dog. You have to start with dental care really, really early. If you have a puppy, it's super important to start handling his or her mouth, touching the teeth, rubbing food on their teeth, lifting the lips, opening the mouth and holding it for 20, 30 seconds. Because if you don't do this, you will have one of those dogs, about 80% dogs belong to that group, that doesn't like to have his or her mouth handled, right? And it can be really difficult. My ringer is still ringing. Jesus. Anyway, so it can be really difficult. It can be really difficult to do anything. Examine your dog's mouth, handling and scaling, or doing anything, right? So handling. If you don't have enough of a handle on your dog, on your puppy early on, then you will have these nippy, fidgety dogs that are difficult to handle. And that can result, unfortunately, in lost years of your dog's life, because you can't keep his teeth in good shape and order. If you have an older dog or adopted a rescue dog, and he or she is not happy about having his or her mouth handled, you have to be gentle but persistent. Most people that I've seen are too soft, and they just don't want to hurt their dog or hurt their feelings more than that. And they just kind of let go. The first second dog starts wiggling. So what happens? Pavlovian reflexes are there. So if dog wiggles and we let go, dog will wiggle and wiggle and wiggle. And then when I examine dogs like that, it's super hard. Like, it's so hard and so frustrating, and people are worried, and everyone is just kind of, the drama goes on, right? And dogs just don't do well with this kind of drama. When I raised Sky, I made sure that I handle his mouth, and it's super important to do that on regular basis, daily basis, and reward dogs when they actually stay still, when you can keep their mouth open for 20 or 30 seconds. It all makes a huge difference. It's not just for for your dog's obedience. This is for his or her health. It's so super important. So if you're unable to handle your dog, it will result in the need of anesthetic cleaning, and we try to avoid it as often as we can. Some people don't believe me, but Sky did not have one single anesthesia in 16 years for either dental care or anything else. Obviously, he could have gotten injured, and we were just lucky. But when it comes to dental care, I know that it is possible to do it with anesthesia, but you have to keep a really good handle on this and make sure that you're not procrastinating with starting the dental care. Now, brushing and toothbrushing. There's a lot of questions that people ask. One of them is whether toothbrushing is actually necessary, and I think that the answer is yes and no. Most of the time, yes, and in some cases, not. But I would say in general, remember that toothbrushing is good. When I started working in veterinary practice as a vet, the pet food companies or the veterinary supply companies used to bring dental toothpaste for dogs and then dental toothbrush for dogs. And I was always wondering, why does a dog toothbrush cost like $10, $15 and a human toothbrush would be like $3, $5? It was really funny to see. And I didn't really like that idea of buying special toothbrush. And over the years, I learned that the best toothbrush is actually an ultrasonic toothbrush, electric toothbrush, because it really works well. And if you ever tried electronic toothbrush yourself, you will probably testify that it is much better than regular toothbrush. So I usually get dogs used to an ultrasonic toothbrush, and I have it here. It's working. And I like the Sonicare because and I'm really not advertising for the company, I just like their product. But this is Philips Sonicare, and it's a wonderful tool when it comes to keeping your dog's teeth healthy. And you may think, well, my dog will not allow me to brush teeth. If you put liver pate or something really tasty on the toothbrush and start with that, your dog will love you. Now, I have something that I use instead of veterinary toothpaste because, once again, the questionable ingredients in them, they're kind of sticky, they're messy and all that. I actually use coconut oil, organic virgin coconut oil, and basically, I normally would put it in the bowl, but I'm just going to dip right in the jar because this toothbrush is brand new and clean. And you just put a little bit of coconut oil on it, and I'm going to do that. And then you brush your dog's teeth. Initially, this is kind of greasy. Initially, your dog will like the flavor, but may not like the sound or the feel, how it feels. So just get him used to it. Do rewarding when he stays still. Get them used to it. Connect it with something positive. I have to take a little drink of water. This is too greasy. Anyway, dogs don't like a little bit of coconut oil. It has antibacterial properties, also teeth whitening properties. So it's a really good ingredient. So generally, I say toothpaste, the regular dog toothpaste is not necessary. Some of you may ask, and what about the abrasive nature of the toothpaste? I don't think that it's as big of a problem. I think that you can really use the coconut oil and it'll be fine. If you do want to use canine toothpaste, go ahead. But as I said, sometimes the ingredients are less than optimal. How often and how long to toothbrush? Now, I usually say daily. And in younger dogs, if you're feeding bones, and I'll get to that topic later, it may not be necessary daily, but I say, maybe get to the habit of doing it daily because when your dog gets older and you really need to do it daily, then you're going to be already there. Toothbrush your dog's teeth before your teeth, maybe in the evening. Excuse me. I have the hiccups from the coconut oil. Now, raw bones. I know that many of you are wondering how to use bones for dental care. And pet food companies and veterinary companies sometimes make a big deal of us feeding raw bones, and I have been recommending raw bones since 1997, so it's actually 20 years. And I have not seen one single dog coming up with a problem, whether obstruction or anything else, when the right bones are fed, meaning they must not be cooked, always raw, remember, raw, 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 raw. And then the other one, they should never be too large. And I'm going to show you some examples of the bones. I was looking for a picture and I did find some examples. I hope you'll be able to see it. So there's a little bit of a reflection in the window, but you can see that there are some smaller bones and larger bones, and I'm going to try to tap. This is a marrow bone, large marrow bone, and this is a big no-no bone because dogs can crack their teeth on this particular kind of bone, okay? Shank, lamb shanks, they're too hard for our dog's teeth. And I see it all the time that people actually buy big beef shank bones, and then a few days later or weeks later, their dog comes in with a fractured tooth. They're just way too hard and not ideal. Something that is more crunchy, like this is let's see what it is. It is actually, I think that this is a lamb neck or something like that. Great bone for dental bone. This is a lamb shank. Again, if the bones are crunchy, they are actually the right bones to feed. Now, some people say, "Oh my God, what about the splintering and what about the sharpness of the bones?" Dogs have the ability to actually digest and dissolve the raw bones, the crunchy, splintered bones in the stomach, so they go in the intestinal tract and do not harm or perforate the intestine. You don't need to worry about that. I have not seen one single case in 20 years of that happening. Here we have some chicken wings, great bones for smaller dogs. So there's a difference between a large dog and small dog. For any dog, don't give I keep saying lamb, but don't give the beef shank, and give bones that are crunchable. Now the softer bones, let's say chicken wings, have a crunchy part for small dogs, that's perfect, but for the larger dogs, the soft chicken bones like the carcasses and so on, they're not hard enough to cause enough of a scaling effect on your dog's teeth. So it's super important to give medium-sized bones, sometimes, lamb necks, lamb shanks, chicken thighs, chicken wings for smaller dogs. But smaller dogs can also get the lamb shanks because they can still crunch on a little bit, and they're not too hard to actually fracture your dog's teeth. So this is super important. Remember that. And if you have any questions, we have a whole blog on our website about raw bones and what to feed. Now, if the bones are crunchy, as I said, they scale the teeth. If they're too soft, they don't do much. Bones remove tartar on most of the teeth. The side teeth in your dog's mouth, the premolars, they are really nicely scaled by crunchy bones. Now, when it comes to the canines, the large canines in the front and the incisors, they do not get scaled by bone eating as much. And you may wonder what happened in nature. Well, I think that dogs ate much more skin and furry animals and skin with fur, and those teeth got scaled or flossed with this hair, but we are not really giving our dogs fur and skin. So we may need to brush the front teeth and also scale off the large canines because they do not get scaled by bones. This is super important to remember. Even if you're feeding bones, toothbrushing and maybe some hand scaling or scaling may be necessary. Now, this gets me to answering the question: Is toothbrushing necessary and hand scaling necessary? Absolutely, even when we're growing bones. And sometimes I'm repeating myself, but it is actually a good thing to repeat certain important things. Now, dental scaling under anesthesia. I have to touch wood, but I have not lost one single dog under anesthesia in 30 years of my practice, and I'm so happy about that. It requires a lot of patience and care and attention to detail and good stuff. So anesthesia in general is safer than leaving your dog's rotten teeth in his or her mouth. So remember that if we kind of look at the pros and cons, I would prefer my dog going under anesthesia if it's necessary, if I haven't handled the holistic and alternative care fully and 100%. Instead of leaving your dog's teeth rotten. So anesthesia is not, ideally it should be prevented if not necessary, but it sometimes may be necessary to keep your dog's teeth healthy. But reducing the number of anesthesias and procedures is super important. So mild tartar is actually usually scaled by hand if your dog is okay with his or her mouth handling. And I'm just going to show you a picture of what mild tartar would mean. So this is the kind of image that you may see with mild tartar. Sorry, there's a reflection again. You can see that the gums is reaching to the crown of the tooth. There is no recession of the gum, and there is no subgingival tartar. Those are the times when you can actually take a dental scaler, or actually take a hygienist and dental scaler and have those teeth scaled. I would not recommend having the scaling done, or you doing the scaling, because unless you have experience, really a lot of experience, it often ends up with incomplete scaling and problems, and tartar that is left can be source of infection and inflammation and problems, right? Now, I'm going to show you when not to actually attempt to scale your dog's teeth when they look like this. You can see that there's quite a bit of recession, and there's also tartar under the gum line. And I've seen some people trying to either brush off tartar by toothbrush, which just spreads the bacteria in the mouth and in the bloodstream, and it can damage the internal organs. So if you see moderate to large amount of tartar, it is better if you have those teeth scaled under anesthesia, as opposed to trying to do it by hand, even if you have or know an experienced technician. Because it's almost impossible to try to scale dogs' teeth under the gum. They always move and they get traumatized, and it's a big drama and stress. So keep in mind that if your dog's teeth look almost clean but not quite, you can do hand scaling. Otherwise, I recommend anesthesia. Also, you can miss problems, fractured teeth, pockets, and all that if you don't do proper examination. So, if you know that your dog's teeth are beyond the hand scaling kind of stage, it is super important to prepare your dog for anesthesia. Obviously, raw diet to strengthen his or her systems, giving all natural supplements that will make your dog's metabolism function better, and that is omega oils that are anti-inflammatory, and this is our feel-good omega here. And then good probiotics for ensuring that the immune system is actually working well. And then green mint, which is a mineral for remineralizing the dental, the bone and the teeth. And I also should recommend, and don't have it here, soul food, which is a multivitamin. Sometimes people ask, do we need to supplement dogs' diet or not? And because food is generally depleted because of the depletion of soils, this is like providing the body smorgasbord of all the nutrients and elements of healthy nutrition, so it can thrive and do well with the anesthesia and with procedures, and heal well and be well. When it comes to choosing your vet, it is super important to choose the right facility. And, as an insider to the profession, and early on I was working in different veterinary clinics, and I saw what's going on. Some clinics do not have the right equipment. Some clinics do not have trained technicians to actually monitor your animal under anesthesia, and they have people who are on the job for a month or two as veterinary assistants, not technicians, and they monitor anesthesia, right? So it can be really problematic. And I want to caution you, just kind of look around your veterinary clinic, ask how the procedure is done, how many people monitor the animals, and never leave your dog unattended in veterinary clinic overnight. Okay, if your veterinarian says your dog had extractions and I need to keep him or her overnight, ask questions. Is there someone 24/7 in the clinic? If not, take your dog home or choose another clinic. But do not let animals be unattended in veterinary clinics. Do not let your dog be in that danger, because it happens that dogs have some sort of complication after anesthesia and nobody's there to help. And still there's a large number of veterinary clinics who have no attendants or technicians on duty at night. So this is super important. The most common problems found in dental procedure are fractures, and I talked about them a little bit. Deep pockets in the gum where there can be infection residing, and it's super important to have that dealt with and treated. Abscesses and sometimes tumors. When it comes to dental tumors, keeping your dog's teeth healthy will reduce dramatically the chances of tumors, because inflammation is a precursor to cancer and tumors. And there are some dogs that would have benign tumors, especially boxer, short-nosed dogs, pit bulls, little Frenchies. They would have excessive gum growing around the teeth, and it's a benign condition which is called epulis, and it should be treated because it can also deposit or hold tartar and plug underneath. But remember that it's super important to do proper exam. And if you have your dog's teeth, or if your dog has teeth that are beyond the first stage of tartar buildup, it's super important to do this under anesthesia, because you can miss things, right? And problems. After anesthesia, most veterinary clinics recommend pain control, and I need to caution you, I've had a few situations where my patients went to a specialist for dental care, and they were middle-aged or senior, and they got meloxicam or metacam, and they ended up with renal insufficiency and renal failure, despite the fact that all of them had normal kidney function before the procedure, pretty much within a week or two after the procedure and after meloxicam. They would have renal insufficiency. So I'm kind of wary. I'm kind of afraid of NSAIDs or non-steroidal anti-inflammatory drugs, because I've seen so many side effects, and I think that it's disregarded. I think these drugs should not be prescribed as frequently as they are. Now, when it comes to antibiotics, if your dog has moderate to severe tartar buildup, it may be necessary to prescribe antibiotics to prevent bacterial spread in your dog's system, because it can affect the heart, where the bacteria settles in the heart valves or around the heart valves, and it can damage the heart. And kidneys, because again, kidneys are very sensitive to bacterial spread, and they can get infected and they can fail. So I sometimes do choose to use antibiotics during dental procedure, because it's the least of the two evils. And when it comes to pain control, you can ask your veterinarian if there is an extraction to use opioid drugs that are much more gentle on the system. At least that's what I've seen. And I have a few extractions with my wisdom teeth, and I tested homeopathic remedies, and they work really, really well. And I have wrote it down here for you again, but it'll be reversed, so you have to read backwards. So it's arnica 200C or 1M, those are the potencies, and I would give them after extractions every 2 to 4 hours for the first day. And then after the first day, I would give chamomilla, which is chamomile, a homeopathic remedy, and it's 200C, and I would give one dose for 5 to 7 days or so. I've used this myself, and I was really surprised how very little discomfort I had. And I think that with most extractions, it can be done. But if your dog is in discomfort, it's good to have some sort of pain control that is gentler on the body. It doesn't cause as many side effects. Let me see. Have I gone through everything that I needed to go through? Dental scaling without anesthesia is the next topic. And it is the most controversial topic because so many people ask about it and so many people do it. And it is super important to know when it should be done or when it can be done and when it shouldn't be done. I personally hand scale my dog's teeth, Sky's teeth, every 3 to 6 months. And, when I saw that there was a little bit of a buildup, I would just take the scaler and I would scale the gums, and he was very good. And I would give him a lot of treats. The problem is, and I mentioned that before, that people try to scale teeth that are beyond hand scaling when there is a lot of subgingival tartar and when there is a lot of infection, and then we are just risking incomplete scaling, infection spread, missing an issue, missing a pocket, and this is super important to remember. Don't have your dog's teeth hand scaled when they are beyond the first stage, and I'm just going to show you the picture again so you remember. Let me just see, where are my pictures? For some reason, oh, I'm almost there. Bear with me. So the upper section is where I would still dare to hand scale, or where I would recommend a good health technologist or dental hygienist doing the scaling. But the second version right here, this is where you should not try to hand scale your dog's teeth. Okay? So I hope that you'll remember this. Don't take any chances. You can harm your dog by doing that. Again, the canine teeth, you just check them once in a while, and if you see that there's tartar buildup, you can actually take your nail and just scrape the tartar off and just start at the gum line and go down and try to scale it. But if you have a dog that is not obedient, that's going to be difficult again. So start early, start handling. So scaling without anesthesia can save you money, and it can prevent unnecessary anesthesia. So this is absolutely valid. And I know that many of my colleagues will say, no, this shouldn't be done. This is incomplete, and there has to be polishing done, and your dog is not going to hold and all that stuff. Honestly, my dog had really nice, beautiful teeth until the age of 16 when he passed away from an accident. So, I have no reason to think that dental hand scaling is inefficient. I think that it's very effective, but it has to be done the right way and for the right dog. Now, I have a few more frequently asked questions here, and then I'm going to let you ask questions yourself. Some people ask whether dental treats are okay, and I'm just going to show you one little slide here of ingredients for a very well-known dental diet. You can probably track it down. I'm not gonna tell you the name because I don't want to deal with the lawyers of the company, but I'll show you what is out there. So this is a dental treat example, and I'm going to read the ingredients because, again, it's reversed. Unless you see it right. I don't think you do. I do actually see it reversed. So the ingredients are, I'm going to read. It locked on me. Technology. Brewer's rice, whole grain corn, probably GMO, genetically modified, chicken byproduct meal, powdered cellulose, pork fat, soybean mill run, lactic acid, chicken liver flavor, soybean oil, and a whole bunch of chemical supplements. So, if you look at this kind of dental treat, I wouldn't give it to my dog. I wouldn't eat it myself. I never give my dog food that I would not eat myself, even though I don't eat as much meat. I very rarely eat meat, if any. But when it comes to wholesomeness of ingredients, your dog is not any less worthy of good quality organic ingredients. So if you see brewer's rice and grain corn and chicken byproduct meal, which is horrible, and powdered cellulose, which is basically wood chips, I wouldn't be giving it to my dog. It's just not right. So dog treats, bones. That's what it is. And plus, dog treats are not really abrasive. They have starches and carbohydrates, and they build up on the surface of teeth and feed the bacteria. So it's not really ideal. I have no idea how it happened that we have fallen for dental treats of processed food companies. It's just sad. Anyway, how about the anti-plug and Tartar sprays? They sound really good, and I don't really know where they got the testimonials, but I've never seen them really work. Maybe they work if your dog's teeth are perfect and then using them. I've never really tried to use them on an ongoing basis or did any tests, so you have to actually, decide for yourself. What to do when your dog's teeth are fractured? I go with the rule that large teeth should be ideally saved because if you remove them, the opposing teeth will get a lot of buildup and they can sometimes abscess because there is no opposing force and chewing against that particular tooth, right? So if you lose one tooth at the top, then the other tooth at the bottom will suffer with infection and tartar buildup and all that. Plus, dogs need large teeth to chew. So if you have a dental specialist in your area and he can rescue or save a fractured tooth, it's better. There's a lot of controversy around root canals or no root canals, and I'd say it really depends. I think that it's better in general to save a dog's teeth and do a root canal and have it checked in 6 to 12 months to make sure that it holds. Okay, if you notice that your dog cracked his tooth, I would really check your dog's teeth daily, because if it's really fresh fracture, you can actually fill the tooth with a little bit of a cement and it will repair and restore. And most people do not know that. They can actually do pulp cap. I don't really know whether it's still called that way, but we called it a pulp cap, where you actually put the cement matter and the tooth will regenerate and will close again. So this is super important. If you're looking at your dog's teeth, there's 2 different kinds of fractured teeth. Some that are open to the pulp and the nerves and the blood vessels are exposed, which leads to infection and abscesses and a lot of discomfort. Or there may be teeth that are just fractured off, a little bit of a chip, but they're not open. And those teeth are actually much more easily saved. I have many senior dog guardians asking me, so what shall I do? My dog is really old and he or she has bad teeth. And I don't really know whether it's safe to put him or her under anesthesia. And I say that unless your dog is seriously ill and has a systemic condition, I think leaving rotten teeth actually is more detrimental to your dog's health than putting them under anesthesia. But again, you have to talk to your veterinarian, make a decision. If my dog had dental problems and was healthy, 15-year-old, 16-year-old, I would still do dental. Obviously, things can happen, but think about it this way. If you leave the bacteria in, if you leave the infection in, your dog is in discomfort and in pain, and sometimes people leave dogs with fractured teeth or abscess teeth, and I don't think that any human would like to be exposed to this kind of discomfort, and dogs feel pain exactly the same way we do. So I think that we should just deal with the condition and treat it and put your dog under if necessary, obviously reducing the frequency of anesthesias and procedures. But if there's a problem, it has to be dealt with. And yes, things can happen in anesthesia in an older dog, but as I said, it's relatively safe, especially if you have the right team on board. And if you're really worried, just get a board-certified anesthesiologist so the anesthesia can be top-notch and no accidents will likely happen. So I think that I'm at the end of my little presentation here or Facebook Live. I hope that you find this helpful. We are going to be posting some useful links to articles on bones, and we also will be publishing a blog that will have this information on Saturday, with this video being posted and pasted on it. I usually don't check it because I don't really like to be on video, believe it or not, and so I just kind of post it and don't edit or cut. Anyway, Angela may have some questions from you, and I'm going to ask her to get on board here, and we'll take let's take 10 minutes for answering questions maximum. And thank you so much for all the likes and positive encouragement. I'll try to do this more often. It does take quite a bit of time to prepare for these and just kind of organize everything. The good part is that I've had 30 years of questions coming from clients, so this way I can give you the information and you can share it, and hopefully you will and learn. So Angela, do you have any questions there? Maybe there's none. Angie, are you there?
I am here.
Oh,
Hi.
I thought you left.
No, I'm just hiding quietly.
Okay.
Yeah, we actually did get a lot of really, really good questions in from the community today.
Okay, great. We are going to be adding them to that article as time progresses. I hope to put the answers there too.
Absolutely. I'm making note of them as we go. Our first question came in from Martine, and her question, and I noticed we didn't mention this, for small dogs under 10 pounds who have very few teeth, what type of bones are best? And she's specifically asking, are chicken feet okay?
Chicken feet generally are okay, even though I don't have much experience feeding chicken feet. I don't know, I find them kind of too graphic. If your dog has lost his or her teeth already, this may be the situation where you just need to brush and hand scale and hopefully avoid as much anesthesia as possible. But this is the kind of example where things got too far and you may not be able to feed bones. You can see if your dog likes to chew on the chicken feet. I think that it should be fine. Make sure that you're not giving your dog too much of a task, and if teeth are loose or if they have tartar, they should be again assessed and evaluated. So if your dog is missing teeth, talk to your vet and see if bones are okay, but many vets would say that bones are not okay no matter what. So just kind of go with your gut instinct, okay? It should be okay if your dog can handle it and doesn't have discomfort.
Great answer, thank you. We've had a few questions come in talking about the coconut oil to use instead of toothpaste. So I've got a few different questions here. I'm going to pose them one at a time to you.
Okay, so the question is about coconut oil, and I'm going to let Angela speak.
We have two very similar questions. One from Beth, do I just brush with coconut oil? Do I need to add anything else? And we also had April asking about mixing Diatomaceous Earth or Bentonite clay with the coconut oil to make a homemade canine toothpaste. And what are your thoughts on that? That's an interesting.
Okay, so first, you can use just coconut oil because the abrasive nature of the toothbrush. This is an amazing toothbrush. They have it in Costco, by the way. I love it, love it, love it. I'm kind of addicted to it, I think. So you can use just the coconut oil and you will see, like if you do this daily, your dog will have tartar-free teeth. And if you see some tartar, you can just scale it, hand scale it with the help of your veterinarian or technologist or hygienist. Diatomaceous Earth, I know that Diatomaceous Earth is very popular. And it is microskeleton of little microorganisms that deposited over thousands and millions of years. But it's very sharp and it can kill a flea if you pour it on the flea or an ant. And I'm wondering, the histology of intestinal loops is very fine. And if I have something that can kill a flea because it's so sharp, I always worried about Diatomaceous Earth embedding in the intestinal tract. And I would have to do study again. We would have to feed dogs Diatomaceous Earth, and then when they pass away, do a study, do assessment, histology, and see whether there is any trauma to these intestinal loops. I just don't like it personally. I don't have any proof that it's damaging, but I don't like it. When it comes to bentonite clay, as far as I know, it is not the same as Diatomaceous Earth structurally, and it should be fine. But I think that it's okay just to go with the coconut oil and a good toothbrush and just have an extra head. I have several heads here that you can switch. You can have one for yourself and one for your dog, and just use coconut oil. And I suspect that even without coconut oil, just water and the toothbrush would be fine. But do a little experiment and let me know. Give me feedback. Send me feedback. Angela, what is the next question?
Yeah, that was wonderful. I've got Molly asking, how does she treat gingivitis after doing a hand scaling?
Very good question. I was saying that if the degree of gingivitis and tartar buildup is very severe, we sometimes need to use antibiotics, but use probiotics after the antibiotics or even during the antibiotics, because they will replenish the bacterial flora. When it comes to the gum irritation, I like to use, I've sprayed healing solution or skin spray, which is on our website. I don't have the bottle here, but it is actually healing and it is safe to use in the mouth. And it works beautifully for any inflammation and irritation. So you can actually, post-dental procedure, you can just spray the solution on your dog's teeth, or you can put it on a little bit of a swab and rub it on your dog's teeth and do it several times a day for maybe 3 to 5 days until the inflammation settles. If you see that the inflammation is there on an ongoing basis, that means that there is a problem, right? There may be tartar that has not been scaled off, and you may want to have your dog's teeth examined. So that's that. Oh, one more thing. Many people use, or veterinary clinics use chlorhexidine or hibitane or chlorhexidine washes, and I don't really like them. If you look at medical safety data sheets of chlorhexidine, it is quite toxic actually, and I just don't like using it in the mouth, even though dentists like to use it. Angela.
Excellent. I have a question from, actually 2 questions sort of from Suzanne. And the first one is just wanting to confirm that you said not to do hand scaling without anesthesia if it is stage 2 or above. And what about dental x-rays? Does a dog need anesthetic to do dental x-rays? And how do you feel about
dental x-rays? Dental x-rays in general. I have I have 2 mindsets. If I put a dog under anesthesia and teeth are rotten, then dental x-ray may be a very good idea, actually, are indicated. If I see healthy teeth with no evidence of inflammation or pockets or anything like that, I will try to avoid dental x-rays, not only in dogs, but also in humans. When I go to my dentist, I am quite adamant about not wanting dental x-rays done unless absolutely necessary. There has been a link now. It's been proven that dental x-rays are actually related, or there's coincidence between dental x-rays and brain tumors. And I had 2 family members actually passing away, my brother and my brother-in-law, from brain tumors. And I see brain tumors being rampant. And I'm always asking, is it because dentists are so keen to take so many dental x-rays every year on everyone? Like it can be 30 dental x-rays in a lifetime or more. And that's way too much. So yes, dental x-rays may be indicated in teeth that are affected and they're problematic, but try to avoid them and be very clear with your dentist. Like they are not going to be there to look after you or look after your family or your dog when there is a brain tumor or oral tumor, right? So be cautious about x-rays. I try to use them sparingly. That's my opinion. Angela, what is the next question? I'm holding a microphone by the computer here, so they can hear you.
What about turkey necks or duck necks as a dental cleaning bone?
My general experience is that poultry necks are almost too soft. At least chicken necks are. Turkey necks may be okay. Feed them, see what the results are if your dog's teeth are clean or not. I forgot to say one more thing. If your dog has mild tartar, let's say I have a new patient and the dog has mild stage 1 tartar, I will suggest just to start feeding dental bones and see what happens instead of taking dog to hand scaling or even under anesthesia, right? So it is possible, with the exception of the canines and the incisors in the front, to scale your dog's teeth if there is a certain level of buildup, if you give the right bones. And again, there will be an article posted in the comments here. Angela, what is next?
The next question is from Jen, And she says she has a Yorkie who is prone to dental disease and has to have the teeth cleaned every 6 months. Is there anything she can do naturally to try and save his teeth at this point?
I was looking for a stuffed animal to kind of demo how Yorkie is when it's handled. It's like this, like I try to open the mouth, and it's beside most Yorkies don't like to be handled. They also sometimes like to bite, even though they're nice, they like to bite. So it can be complicated, right? It starts with very gentle handling and patience. There is no other way than when you have the scaling under anesthesia, I assume, done. Start brushing, start hand scaling, do everything you can to actually keep those teeth as clean and healthy as possible without anesthesia. And it's beyond the scope of this webinar, but handling is super important. Like when I handle a dog, I imagine that I'm like a tree. I'm solid and well grounded, but I don't always let go, right? So if I hold a dog, I do my yoga practice with dogs. I hold their head first, and I would just if they try to move, I would just move my hands back and forth with them a little bit, but always try to get back to the center like a tree does when there is wind, and then it returns back to center, right? And so I just get them used to it, and I praise them when they stay still, and they eventually get it. And the same with handling the gums. I would hold the lip, and I would rub food on the teeth, and then I would rub a little bit of coconut oil, and I would handle the mouth, and sometimes you can get salmon pate, liver pate, something really tasty. I've had some people telling me that dogs should never be held against their will, and I kind of agree. But what I also think dogs like is they like guidance. So my friends just got a new puppy, and he already is not happy with having his nails trimmed and the mouth handled. And when I take him, he tries to wiggle out and la la la. So I grab him, and he tries to wiggle out, right? And I don't let go. I try to hold him and be gentle, like the tree, but I bring him back and I praise him. And the funny thing is that he eventually relaxes. And even more bizarre thing is that, one would think, okay, I did something that he didn't like and he will hate me and all that stuff. I just came back from Vancouver to Maui, and the first time I saw this little doggy, his name is Opie, he was going crazy for about 10-15 minutes. I was thinking, okay, so I think that we're all good. Like, I don't think I crossed his boundary, and he doesn't feel like I did something wrong. He kind of loves me even more, I think, because I gave him exact instructions what I'd like him to do. So be patient with your dog, with your Yorkie or any dog that wiggles, and see how it goes. Like, it's worth a try, right? Because it's about your dog's health, years of life, and time spent together, the gift of extra time. I miss Sky. I miss him so much. Anyway, by the way, if you're asking when I'm getting a dog, it's 2019. I wrote a newsletter about it. I'll be traveling, spending time with my mother, and I really want to have a good chunk of time with our new doggy. I can't wait. I would like to bypass the 2018, but I know that I have some other things to do. I'll be looking after Opie instead. Angela, what else do you have? Last question.
Yeah, I have one last one that came in before we started taking questions, and it's from Gina. She has a 14-and-a-half-year-old Dachshund that has advanced dental disease. He has had 3 or 4 dentals in the past, but none in the last 4 years or so. He also has a heart murmur and early-stage heart disease, so she's terrified to anesthetize him and wants to know what your thoughts are in that situation.
This is a really good question. I'm glad that we are ending with this question. As I said, it is much more detrimental to leave the infected teeth in a dog that has cardiac or heart condition already. Depending on how severe the cardiac condition is, there should be blood work done, an ultrasound to see how severe the heart murmur is and assess the cardiac function. And I would probably suggest to definitely do this procedure with a dental specialist and with an anesthesia specialist as well. And if you do, I think that your dog will be safe unless those two experts say, we don't think that it should be done because your dog is too far. But generally, I think that there are many dogs that suffer unnecessarily because dog guardians are not giving enough instruction and enough support. So in that article that I wrote, there will be enough information about what to do and how to do it, how to make these decisions. Talk to your local veterinarian, ask for a specialist, ask for an anesthesiologist. And, of course, something can happen to any dog under anesthesia, especially older dog. But I would say, once again, the risks are relatively low. I haven't lost one single dog under anesthesia. And I think that many other veterinarians are like that. So it is not as bad as you may think. But talk to your veterinarian and see what he or she thinks. That's what I would say about older dogs in dentistry. Thank you so much for attending here and keeping an eye on your dog and your dog's teeth. This webinar will be available to share, so please share it if you can. And if you have any questions or anything, if you need to know anything about our articles, anything, oops, I'm just going to give you something else here. Oh, do I hate technology sometimes. Oh, Angela, rescue me. Here is our website, peterdobias.com. So don't forget to subscribe if you're not subscribed. And you can search for all the different articles on bone feeding and supplements and different conditions. We have tons of information. And we have also 5 or 6 team members who answer questions not only about our products, but anything that you may want to know. Obviously, there's limitations. There are limitations. We can't consult over the internet or through email, but we'll do our best to answer questions. And thank you so much for being here and caring for and loving your dog. Take care. Bye.